In the news, 9 cases of measles have been confirmed in Wisconsin, all 9 in Oconto County, north of Green Bay. Now, doctors say it's unlikely those 9 cases will lead to a significant outbreak.
Still, the cases come as back-to-school season is just around the corner, and our Maddie Heimsch has the latest data on just how safe our students are as they go back to the classroom.
New data released by the Department of Health Services shows 86.4% of students met the minimum vaccine requirements for the 2024-25 school year. Now, experts say its new meningitis requirement is responsible for a drop of nearly 3% from the year prior. Say without it, the rate is in line with recent years, but on a wider scale, significantly lower than the nearly 94% rate we saw in our schools 20 years ago.
Most Wisconsin families are protecting their children with vaccines, but unfortunately this level is below where we need to be to protect our state against outbreaks of vaccine-preventable diseases.
Where we need to be, Dr. Ryan Westergaard with DHS's Bureau of Communicable Diseases says doctors generally consider 95% to be a safe community vaccination rate.
On a population level, there is a rule of thumb that we aim for, whereby if we do have an introduction of a case, that it's very unlikely to cause an outbreak.
But when it comes to measles, Dr. Westergaard says even 95% may not be enough to stop a spread.
It's higher in measles than it is for many conditions because measles is so extraordinarily transmissible. One of the most contagious viruses that we know about.
And not only are Wisconsin rates below that 95%, but they're below most other state averages. Data from the CDC showing vaccination rates for Wisconsin kindergartners lagging behind all but a few states since the pandemic.
We're one of only 13 states that has the personal conviction waiver. Many states do not allow that.
The data shows 6.7% of families requesting at least one vaccine exemption for health, religious, or personal conviction reasons.
This is higher than most states.
Dr. Westergaard says because the 9 measles cases in Oconto County were exposed to a common source while out of state, there is not a high risk of an ongoing community spread. But he recommends keeping your student up to date on their shots regardless. And if you have any questions about requirements, you can always ask your provider.